Welcome to an HMC HealthWorks podcast. Today we're so pleased to be joined by Eileen Donnelly, and Eileen is a registered nurse and she's also our Director of Quality at HMC. So welcome, Eileen.
Well, thank you so much for having me today.
I'm so glad to have you here because, as you know, it's February's American Heart Month, and in the U.S., someone has a heart attack every 40 seconds. And according to the CDC, the 5 key risk factors for heart disease and stroke are high blood pressure, diabetes, high cholesterol, obesity, and smoking. So I was hoping today that we could discuss each of these risk factors. So, let's start with cholesterol, high cholesterol. What are the symptoms?
So actually, Vicki, there are no symptoms of high cholesterol. The only way you can really detect high cholesterol is in a blood test. So when we talk about cholesterol, we're looking at 2 types of cholesterol, the HDL and the LDL. So the HDL is the one we know as the good cholesterol. The HDL picks up excess cholesterol and it takes it to your liver so it can be flushed out of your body. The LDL is the one we know as the bad cholesterol. Now, the LDL can build up on the walls of your arteries. It makes them really hard and narrow and obviously causes difficulty for the blood to flow through. Sometimes those deposits can actually break off and they form into a clot, and that's usually what causes a heart attack or a stroke. Your high cholesterol can be inherited, but often it's a result of unhealthy lifestyle choices. The positive part of that is it also makes it preventable and treatable. So usually a healthy diet, regular exercise, and sometimes you need medication. Those things together can help you reduce your high cholesterol.
Good. That's good to know. I'm glad that you explained the difference between the HDL and the LDL, because I know a lot of times that gets confusing for people. And so what I try to do myself when I get my blood work is when I think of HDL, I think of the first letter H as happy, which indicates that it's the better, the good cholesterol. So in talking about the other type of cholesterol, which is more unhealthy, it made me think: do folks have to completely give up food like French fries and sweets to be healthy?
No, you don't have to absolutely give up anything. The key to everything is moderation. So obviously most people do enjoy some less nutritious treats from time to time. But when sweets and fatty foods become a staple of your diet, your heart can suffer from the buildup of plaque that can cause a heart attack or stroke. So on the flip side, you want to be consuming healthy foods like fruits and vegetables, and those things can help protect your arteries from having any plaque buildup. So as a rule of thumb, again, all things in moderation. Go ahead. Enjoy the fries now and then, but make sure you're offsetting them with things like other healthy foods to ensure that your heart can properly do its job.
Yeah, that makes sense. So I wanted to ask you, we were just talking about the fatty foods and sweets, and, you were explaining some of the negatives associated if we have an overconsumption of those type of foods. So that leads me into the next risk factor. I wanted to ask you about being overweight. I mentioned earlier, according to the CDC, obesity is a risk factor, and having a body mass index of 30 or greater puts people at risk, for high cholesterol. Mm-hmm. It also puts them more at risk for heart disease. So I'm wanting to ask about being overweight because I know that the experts indicate that exercise is a part of mental and physical fitness and also helps us control our weight. And so I'm wondering, does everyone need to exercise?
Absolutely. So yes, good question. And yes, everybody should find ways to get exercise into their life on a daily basis. It could be going to a gym. It could be taking a nice brisk walk. Anytime there's any barriers that are keeping you from exercise, is a way to find a way around them. Again, everybody does not like a gym. That might not be their style, but they can go out and take a good brisk walk. They can find things around the home. What you want to do is make sure you're getting at least 20 minutes of exercise a day, and that 20 minutes can even be broken into 2 10-minute sessions, which anybody can find the time to do that. But yes, exercise is very important.
Yeah, and I'm glad that you mentioned about maybe the gym is for some people, and that there are, you can do it at home or in other ways. And I know since COVID-19 hit, it's been harder to exercise for people that went to a gym or might be reluctant to go to a gym. And so that also will apply to them as well as people that just never were into the gym. What are some things that people can do at home?
That's a really good point as well, that people are not near the gyms as much anymore. So first and foremost, if you haven't been exercising at all and you have no idea really where to begin, first thing obviously you always want to do is talk to your doctor and make sure that you have clearance to exercise. And once you do that, again, we're going to aim for that 150 minutes per week of moderate intensity exercise, like we just discussed, breaking it down to about 20 minutes a day, even 2 10-minute increments. Some of the things you could do at home if you don't go to a gym, stairs. If you have stairs, you can go up and down the stairs. You can put your headphones on and dance around your house to music. You can march in place during commercials when you're watching television. You can go outside and get some fresh air and take a nice brisk walk or take a bike out for a ride. If the weather's not conducive, you can always do a stationary bike or a treadmill indoors. Anything you can do to really move around and get that heart rate moving is going to be a positive for you.
Yeah, those are great suggestions. I really liked your idea about popping in the headphones or turning up the music, because that sounds like fun and a good way to burn some calories. Another thing I was thinking about when you were saying about going outside, I have several friends that tell me having a dog has been a great way to help them with fitness and weight control, because they're motivated to go outside and walk and be more active so that they're caring for their dog properly.
That's really a good point as well, Vicki, and that's very true. Having a pet, obviously you have a responsibility to take care of your pet and take them out and get them fresh air and get them for a good walk, and in turn, you're getting the same thing for yourself. If you don't have a pet, though, there's also other things you can do. Your chores, yard work, doing gardening and yard work, cleaning your house, all those things do burn calories and are considered an exercise.
So, yeah, that reminds me that I need to be doing some house cleaning, and then I can get some exercise in. So, on the other side of exercise and weight and for weight control, what if somebody is already at a healthy weight? Why should they exercise?
Again, that's a really great question. Exercise increases the blood flow to your muscles, which gives your circulatory system a really needed challenge. So as your heart beats faster when you're moving and your heart's beating faster, your blood circulates more quickly and it delivers extra oxygen throughout your body. So what that does, obviously, is helps build a real strong heart and give you good cardiovascular fitness.
Yeah, those definitely are good reasons, and that's good for people who also don't exercise regularly. So you know what? I want to talk about hypertension, or what is commonly referred to as high blood pressure. And I know, according to the CDC, this is the single most modifiable risk for stroke. Talk to me about what a healthy blood pressure is.
So controlling your blood pressure means keeping it under 130 over 80 for most people. So to achieve a healthy blood pressure, again, it's taking us back to everything that we're talking about here, Vicki. A healthy diet, exercise, weight control, eating more vegetables and fruits. Those things are all going to work towards keeping your blood pressure. There are times that the doctor may decide to give you a prescription medication as part of the blood pressure control. Always, with any medication, you always want to speak to your doctor, let them know any concerns or questions you have, and obviously always make sure that you're taking that medication as prescribed as well.
Yep, that all makes sense. Eileen, in talking to you, sort of what I'm noticing is that all of these risk areas for heart disease have a big overlap of ways to address it, is as you've been describing us, management of our lifestyle through diet and exercise. And I'm also wondering, is that also the case with diabetes?
Yes, that definitely is.
Yeah, because I know a little bit about diabetes because my son-in-law is a type 1 diabetic and was diabetic since childhood. And, he's explained to me that diabetes is a disease in your blood glucose or blood sugar levels, which is the term he uses, and it's when the levels are too high. And glucose comes from the foods that he eats or that we all eat, and insulin is a hormone that helps the glucose get into the cells to give them energy. With type 1 diabetes, your body doesn't make insulin. With type 2 diabetes, the more common type that I think more people hear about, your body does not make or use insulin well. So without enough insulin, he was telling me the glucose stays in your blood, and also for people that have not become a type 2 diabetic, he was explaining to me that you could also have prediabetes, which means that your blood sugar is higher than normal, but maybe not high enough yet to be called diabetes, and that having prediabetes puts people at a much higher risk of getting type 2 diabetes. And another thing for people that are a type 1 diabetic or a type 2 diabetic, he was explaining, because he's very compliant and does the things he's supposed to, because he said it's scary. If you have too much glucose in your blood, it can be, very serious problems. It could damage eyes, kidneys, and nerves. And, I know from the CDC, it also can cause more heart disease, stroke, and even sometimes the need to remove a limb. So how can someone tell if they have prediabetes or are diabetic?
That's a lot of good information, and you're right. And the way that people, again, check for their blood sugar would be blood tests. So as we're looking for a blood test for our cholesterol, we also want to obviously be checking our blood sugar. That's the importance of making sure that we are doing our regular physicals with our physicians as well as doing our lab work. So a blood test will show if you have diabetes. They do a test that's called an A1C. An A1C is a test they actually do on diabetics also to see how they're managing their diabetes. So exercise, weight control, sticking to a healthy meal plan, all those things can definitely help prevent or control diabetes. As you mentioned, that prediabetes. Prediabetes, I always tell people that's a flag. It's a flag to tell you your numbers are getting too high and you need to make some changes, because if you don't make some changes, it could go into diabetes. So prediabetes is definitely something, if you hear that word, that you want to really be serious about making some of these changes. Also, you should monitor your blood glucose levels with your doctor, and if they may feel that they're not being totally controlled, if they do recommend medication, again, like we talked about, just discuss any concerns, questions you have, and always take your medication as prescribed by the doctor.
That's great advice, Eileen, and boy, I liked your focus on following the advice of the doctor and keeping frequent appointments with them and being compliant with the things they're suggesting that you do. And the last risk factor that I had talked about at the beginning of the podcast, and I wanted to really discuss this with you, is smoking. So I think a lot of times, because there has been a large reduction in smoking in the past 30 years, but I think people aren't aware that smoking is still more widespread than we think it is, and it accounts for around 33% of all the deaths from cardiovascular disease and about 20% of the deaths from heart disease in people that are older than 35. So talk to me a little bit about cigarette smoking.
So cigarette smoking is actually the chief cause of preventable disease and death in the United States, which is a really, really serious statement. And it actually can harm nearly any part of your body. As you mentioned earlier, heart disease is the leading cause of death, and cigarette smoking accounts for about 20% of those deaths. Cigarette smoke is really what it is a toxic mix of more than 7,000 chemicals. And when you're inhaling that into your body, obviously it's interfering with all the important processes in your body that keep it functioning normally. One of those processes is the delivery of oxygen-rich blood to your heart and to the rest of your body. So obviously interfering with that, can cause serious, serious damage and thus be the chief cause of preventable disease.
Wow, that's a lot to think about, and also it's a good thing to think about because I think it reminds people that it's never too late. Please stop smoking. I did want to ask you about. Let's talk about the benefits of quitting smoking. Tell me how that benefits your heart and your cardiovascular system now and in the future.
So quitting, I mean, there's a lot of tools to help you quit smoking. There's a lot of things out there. Obviously, the first thing we always tell people is, if you don't smoke, obviously never start using them. That's obviously our best option. But if you are a smoker, it's obviously never too late. Obviously, the earlier you quit, the better. The better it's going to be for your health. Quitting smoking benefits your heart, your cardiovascular system. There are little things that they put out there, which to me really, when you listen to these numbers, it really hits home. 20 minutes after you quit smoking, your heart rate drops. Just 12 hours after quitting smoking, the carbon monoxide level in your blood drops to a normal amount, allowing more oxygen, obviously, to your vital organs like your heart. And then within 4 years of quitting smoking, your risk of stroke drops to that of a lifetime non-smoker. I mean, that's huge.
That is huge. And, this is so encouraging and motivating news for smokers. And I know that my brother-in-law and several people I know had used the nicotine replacement therapy. So if someone's really struggling to try to do it, cold turkey or on their own, they should definitely talk to their doctor about those nicotine replacement therapies. So, Eileen, I really want to thank you for spending time with us today and to talk about the importance of heart health and the different risk factors for heart disease and ways to, that we can reduce and eliminate them. So thanks so much.
Oh, you're very welcome. My pleasure, Vicki. Thank you for having me.
Oh, you're welcome. And I want to remind our listeners, stay tuned for future HMC HealthWorks podcasts. And, remember, go to hmchealthworks.com for more info on heart health and all things heart-related. Thanks for joining us today, and stay healthy, happy, and safe.